Every winter I see the same story. Someone was just taking the trash out, just walking the dog, just heading to work, and suddenly they're in the emergency room with a fracture that changes their whole year. Now, these injuries are life-changing. A hip fracture often starts a cascade of events. Patients suddenly lose mobility, they're in bed, they're not moving, and when people stop moving, bad things happen fast. They're at higher risk for blood clots, which can travel to the lungs and cause pulmonary embolism. They're at a higher risk for pneumonia because they're not taking deep breaths or clearing out their secretions. One very common type of hip fracture is the intertrochanteric hip fracture. We call it the IT fracture. The most common operation is an intramedullary nail. This is a metal rod that we place inside the bone to stabilize the fracture and allow early walking. Many patients are able to get up out of bed and even walk the very next day after surgery. Another fracture I see all the time after snow and ice is the proximal humerus fracture, which is a break at the top part of the arm bone, the humerus, near the shoulder joint. When surgery is needed, we may perform an open reduction and internal fixation, or ORIF for short. And that means we realign the broken bone and stabilize it using plates and screws. In more severe fractures, especially in older patients with poor bone quality, the best option may actually be a reverse shoulder replacement. In these cases, the bone is often broken into too many pieces and the chances of reliable healing are quite low. Replacing the joint gives the best chance at restoring function and reducing pain quickly. Good news is that many of these fractures are preventable. Strength training matters. Strong legs and hips help you recover balance instead of collapsing. Strength training also increases bone density, and people of all ages benefit from it, not just older adults. Before you walk outside on ice, do 3 things. Look down, slow down, and just assume it's slippery, even if it doesn't look like it. Snow and ice don't have to turn into surgery. Prepare your body, respect the conditions, and when it's icy, slow down. Nothing is worth a fracture.